Okay, so next question comes from Shelly. I hope that that is correct. Okay. So hi Giselle, was wondering if you can speak on the subject of skills over pills, and the situation where meds are too routinely prescribed and hence the reason why we end up with our lives so negatively impacted, especially the benzos. Just want to add that therapy used adjunctively with your psychiatric provider, I think, is key to growing and learning. Thank you so much, Shelly, for bringing this to our attention. And this is very important. And as I mentioned earlier to a couple of these, with these questions as I'm answering them, that definitely, you want to leverage skills over pills first. So when I'm talking about skills, I'm talking about things like, the thought process. There was that one question about obsessive thoughts, obsessive feelings. Figure out what those triggers are. Doing the work in therapy to overcome those thoughts, those feelings, those obsessions, and better understand why you're having them. Other skills could be things like leveraging diet and exercise. And so, for instance, I've mentioned in multiple videos about nutritional deficiencies that people have, and they're like subclinical deficiencies, meaning they're not acute. You're not going to find them overtly in the lab, so you're looking for optimal levels, right? But if you're not optimal, then that can cause a lot of problems. That's especially the case with magnesium. So that's why I do the serum magnesium and the RBC magnesium, because that one's hard to detect. But anyhow, leveraging good diet, and oftentimes with our diet, especially when we're experiencing stressors in life, that's just life, right? We're always going to have the spectrum of emotions. So we're always going to have anxiety. We're always going to have, downs that are going to fluctuate, right? We can't just be not feeling anything like zombies, right? That's not how we operate. We operate based off of emotions, based off how we're reacting in our environment and what's going on. And so understanding how to cope with life stressors is definitely key. And also with diet, instead of using food as a coping mechanism, which a lot of people do, meaning they eat a lot of junk food. We talk about foods as being comfort foods in our society, especially in the US and the standard American diet. And so that's what we really have to take a hold of, because that creates deficiencies, especially if you're drinking lots of sodas, for instance. That's too high in phosphorus, so you're going to deplete magnesium just by doing that. If you have a lot of stress, that HPA axis and that cycle requires lots of magnesium, so you're depleting that. If you're not getting outside because you're working from home, or you're working in an office and you're not getting sunlight, now your vitamin D is probably deficient. And all of these things are required for proper mental health, for proper brain function, overall health, even neurotransmitter function. And so when I say skills versus pills, it's therapy work for sure, but it's also diet and lifestyle changes. So cleaning up the diet, looking at the Mediterranean diet, anti-inflammatory diets. For some people, lots of research on ketogenic diets helping them to overcome mental illness as well. So looking at those things, looking at what works for you, and what will be a lifestyle change, not a diet per se. So you make it part of your lifestyle. That's key. Then another part of lifestyle is exercise. And people will oftentimes, with exercise, not, think that, oh, it's too hard. I can't, because they're envisioning exercise as being like this really, intense workout. When in fact, just moving has been shown to decrease depression and anxiety, meaning just getting up, walking around the block, walking for 10-15 minutes, that's considered exercise, and you're moving. Even cleaning is a form of exercise. So cleaning your house, when vacuuming, mopping, sweeping, wiping things out, all of that stuff, you're moving, that's exercise. So looking at exercise is not something that is so rigid, especially if it's not something you do, and it's not something like you kind of roll your eyes when people say exercise. Try to incorporate other ways of movement in your life. Then when you start to get a little bit healthier, you can start looking at more intense exercise, and maybe leveraging something like high intensity interval training and things of that nature, which also have been shown to help with depression and anxiety. But yes, I think that's very important. And I also agree with Shelley that therapy adjunctively is important. Now, she also is mentioning about meds are too routinely prescribed, and hence the reason why we end up with our lives so negatively impacted, especially the benzos. So, what she's talking about here is that, so in our society, it's very unfortunate, but when someone comes to a psychiatrist or a psychiatric nurse practitioner like myself, and they're in that like that system of care where, you know, insurance is paying and this, that, and the other, so the provider's kind of forced to do a quick assessment and get you in and out of there. Oftentimes you get slapped with a label, right? Instead of saying, let's look at your diet, let's look at lifestyle, let's do labs, right? Then we just go right to the label. We look at our DSM, we, you know, want to look at symptoms only to check off those boxes, and then give you a pill. The problem with that is if you're not correcting the underlying deficiencies or the underlying issue, that pill is not going to be very effective and oftentimes can be detrimental. You can end up with lots of side effects. Maybe if you did labs, you would find out that you have a high toxic burden, and actually giving you something like a psychopharmacologic medication can actually cause inflammation, right? And can cause a negative response, like mast cell activation syndrome, for instance. Some people have that. That means they can't really be on medications. They have to get rid of the inflammation. They have to get rid of the offending agent. Most psychiatric providers are not doing that because they're not taught to do that. You know, me being an integrative psychiatric provider, there are many others out there as well. So, you know, we do want to look at the whole picture and not just give medications, but in the system of mental health, this is one of the things that is wrong with the system. You get slapped a label and you get put on a medication, and oftentimes, if you're not looking at underlying root causes, over time more gets added to the mix because, well, the SSRI didn't work, so let's do an SNRI. Maybe that partially works, so let's add an antipsychotic. That stops working, let's add a benzo. That stops working, let's add, etc., etc., etc. And now the person's on 4 or 5 different medications, nothing is working, and they're just having a bunch of side effects that now providers are wanting to add more medications to, instead of looking at the big picture and saying, wait a minute, this person is probably experiencing side effects, and perhaps this label we put on them isn't really the issue. Perhaps the anxiety or the depression is a symptom of another underlying issue. That is always the first question that you should think of. And in fact, I've mentioned this before, but our DSM is not flawed. Our DSM, you know, though many people criticize this, one of the requirements for every single diagnosis that gets ignored is this episode is not attributed to the physiological effects of a substance or another medical condition. We don't rule out the medical conditions. So if your psychiatrist isn't doing labs, isn't looking at underlying root causes and just putting a label on this disease process, like, or the symptoms, right? Then they really haven't followed that book. So though many, you know, disagree with the DSM-5, and I understand why, a lot of it is because they're ignoring ruling out those medical conditions, and that requires a lot of extensive looking into the root causes. So sorry, I went on a tangent there, but that's my soapbox for sure.